my study was looking at a case series of individuals at Inclusive Health Services at our institution and seeing which patients were receiving dual long-acting injectable therapy. So by that I mean two agents together. So typically they will receive maybe one agent, but these patients, because of one reason or another, like resistance, adverse effects to oral agents, you name it, many different things, many different stories for patients, they may be receiving two injectable therapies to improve adherence or to combat resistance. And so these patients, we had 10 of them that were receiving dual off-label therapy at our institution. And ultimately, what we found was that they were well tolerated doing both agents together. We were able to make sure that patients were coming to appointments and receiving their injections, which ultimately led to them achieving viral suppression, which is really our main goal of HIV treatment, and when they were never able to achieve viral suppression previously. So this was a great feat for these patients. And in patients who were undetectable prior to starting dual therapy, they maintained viral suppression. So although they were undetectable already, they did maintain it over the study period. One of the key things is that patients ask for it, but they might not always be a great candidate for even just one agent, but even for dual therapy. So it's really important that pharmacists and other practitioners, social support teams really take a second to review these patients in depth and figure out if they are a candidate. So even though they may be asking, it's important to take those extra steps because you want to put your best foot forward and make sure that you're not going to fall into a tricky situation with resistance or adherence to appointments and things like that. So yes, they are asking, but step number one really is to have a team reviewing these patients in depth.